Here's another edition of Ask Dr. Afflalo. Good evening to you, Dr. Afflalo.
Good evening.
How are you doing?
I'm doing great, thank you.
Well, I tell you, it's been a whole month, and so much is taking place since we've gotten together. So let's just catch up. What is going on with IWC primary care? Let's just start there, and then let's get into our topic for this evening.
Okay, so IWC continues to stay busy getting new members or patients that are enrolling into our clinic. We've hired two additional providers to help us with the load. And so we're there, cranking it out Monday through Friday, just making sure that we take care of the patients. And when I meet a few of them, I happen to just say hello to some of the ones that aren't scheduled with me. I go into the waiting room, and they're just the comments that they make about the staff and Mr. Grady Gordon, our office manager and CEO. It warms my heart to know that they just love the interactions and that everyone is so pleasant and warm and engaging. They feel welcomed when they even step into the office. So that's reassuring that we're doing good work and that every single provider that is seeing the patients, they all are doing a great job.
Well, one of the things that they say that when you are hiring new people, it sounds like that you are staying very, very busy and that you're getting more and more clientele.
Absolutely. And that's a good thing. So we're advertising. We've sent out some postcards into the local neighborhood in Spring Valley, and we're getting responses to those and getting new patients from that. And it is open enrollment and coming up, so we expect to be busy throughout the end of this year and starting next year.
So for those people that are in open enrollment, because it is open enrollment, how can they join with you, and what are they looking for when they begin to sign up with the open season?
Yeah, it depends on their agent and what insurance they have. But and we take several insurance. They can go online and check and see what insurance we take or speak to their agent. But really, what makes us stand out is the amount of time we spend with the patients, getting to know them, looking at them as a full human being and not just, hey, you have diabetes and let's take care of that. But just really trying to figure out how we can make the whole person healthy and be able to live a long and productive life. So we're about the whole holistic approach, and I think it's necessary that you spend time to get that information.
Excellent, excellent. So we are in the month coming up, the month of November. Tell me what's happening and what's our topic for today.
So November is Diabetes Awareness Month, but since I did not come last month because we just had too much going on in the community, I wanted to just touch a little bit on the October, since we're still in the last 8 days or so of
Yes.
October. October is Breast Cancer Awareness Month, and so I just want to remind our ladies out there and men, if they find a lump or have some pain in their breast, to go and be seen. So for the women, if you have not had your breast exam and or mammogram this year, please make sure you get it. I want to go over some of the risk factors just in case they're concerned if they might be at higher risk. But every single person, if I put it this way, if they have breast, they have risk for breast cancer, because not all breast cancer that are diagnosed are people that have had a family history of it. So I'm just going to run through them. The older you get, the higher the risk is. So aging, personal history of breast abnormalities or ovarian cancer or breast cancer. If you've had it before, you certainly at higher risk for having it again in the remaining breast. Having any family history, mother, sister, daughter, aunt, or someone with breast cancer, you should really be checked. Even consider getting the genetic testing markers just to see if you are at higher risk. Also, if you've had biopsies in the past when they said you had some kind of abnormality and it said that you had hyperplasia or an area that is generating some slightly abnormal cells or something called carcinoma in situ, which are like precursors for cancer, you're at higher risk for getting cancer later. Also, for women that do not have menstrual cycles or they have menstrual cycles for a long time with no break in it, meaning they start menarche or having their periods earlier than, say, 12, and going into menopause later than, say, 50. So if you're menstruating for many more years and you don't have a break, you don't have a child, you don't have breastfeeding, you don't have any break in that, you're at higher risk. So, having children, having a little break in your cycles does help kind of to protect you. Also, if they do have the mutations, if they get genetic testing, they have the mutation of the BRCA1, genes,
Hmm.
then they're at higher risk. Also, women, you're not going to want to hear that, but every single time I talk about any subject, it always comes to alcohol. So
Okay.
if you drink more than one glass of alcohol a day,
Hmm.
that's certainly they're saying that there's some increased risk of putting your cells, in terms of possibly having mutation. And if you've been on birth control pills for a long time, that also can put you at risk. So there's just a lot of risk factors there. I want women to know about it. Also, if they're carrying extra weight,
Hmm.
those adipose tissue cells can produce estrogen, which puts them at risk. So just keep that in mind, making sure they keep their weight down. So their goal is to really just make sure that they speak to their provider and that they get a mammogram, one that's specific for them, meaning they're screening mammograms, but if they have very large breast tissue or very dense breast tissue, they might need a 3D, and that's becoming more prevalent in terms of being able to screen the breast with a 3D mammogram.
Well, people are saying that when you go in, you should ask for, if you have dense breasts, that you should ask for the mammogram, a sonogram, and a MRI.
Yeah, that sounds like a lot.
Okay.
They probably could start with a screening mammogram or a 3D mammogram, which will give them a little more information. And from there, they will determine if other things are needed. So if they find a lump on exam and they can't tell whether or not it's a solid lump or cystic, meaning filled with fluid, an ultrasound is necessary to determine that. But
Okay.
just to your general screening, you should have a basic mammogram for diagnostic, whether it's just straightforward 2D or 3D. And then from there, they'll determine whether or not you need a diagnostic one, which is more intense viewing.
Mhm.
But I say let's not go in there and have a list of demands. Let's go in and get a basic screening mammogram. And from there, depending on whether or not they see anything, calcifications, or they can't see enough, they'll ask for something more.
Now, can you define what it means that when people say they have dense breasts?
Yeah, so when you're younger, you have a lot of fibrous tissue. It's like a ball of rubber bands. I mean, it's just very fibrous, so you can't see a lot. As you get older, the fibrous tissue is replaced with fatty tissue. So, and of course, the fibrous tissue makes the breast nice and perky. And as they start becoming, as you get older, and as the fibrous tissue is replaced with fatty tissue, you lose some of that elasticity. So now you see the breast down to your knees. But anyway, so what happens is the more fatty tissue, the easier it is to see. That's why it's a little. They used to have screening at 50, because then you could catch something a little sooner. But because we're having so much breast cancer earlier on, they started officially having screening at 40. You still have dense breast there. Exams are helpful because you can feel some lumps, but some women's breast tissue is lumpy and bumpy, fibrocystic. So that's where you probably need an ultrasound along with your mammogram, especially if you find one specific one. Fibroadenomas are just lumpy fibrous tissues. They're usually very benign, but they need to be biopsied to determine that. So that's the reason why fibrocystic breast should be, you should do your own breast exams. If you find anything, bring it to your provider's attention, but also get annual screening mammograms, which will help pick up some differences.
Now, there are a lot of myths and misnomers about even how breast cancer could come about. Some people say that if you don't want breast cancer, always keep a bra on. And then some people say if you wear a bra all the time, that could cause damage and cause breast cancer. Any truth to any of those?
Not that I know of. They all sound like myths.
Okay. And these are the kind of things I think that when people are saying, well, what caused breast cancer? Now, this was really weird to me. I had a friend that actually got cancer in the breast, but when they looked at the cancer or the tumor, it was in the shape of her cell phone that she kept putting there as a holding spot versus holding it in person or whatever. Is there any recommendation of women who put their phone on their chest or whatever, things like that?
Yeah, I'm sure there's some connection to it because of the radio frequency that's exposed or emitted from the cell phones. And I know it's a habit for women to put it in their breast. That's their pocket. They put their money there and everything, but that is not a good idea. They're also finding consistently that there may be some relationship with brain cancer, putting your your phone up to your ear and having that frequency closer to your brain. So, sometimes they're saying the iPods, but the headphones that had the wires are a little less of an issue than the actual iPods. So there is a correlation. They can't say for sure that it will, but yes, it puts you at higher risk if you have that frequency right on near the breast tissue or right on the ear. You have a higher risk for potentially having changes in your cells, which can put you at risk for cancer.
Now, what about these earbuds earpods that everybody's wearing? Is that more healthier, or is that still giving the radio frequencies?
My understanding, so I haven't read all the studies, is definitely better than having the phone up there. But they say that the ones that the little pods that have the wires are a little better choice than the actual iPods, the little things that are just there, because it has more frequency from the thing. But it's definitely better than having the phone up to your head all the time.
Okay.
Yeah. So just in winding up with the breast cancer stuff, I want to make sure that women know, especially African American women, that they're at a higher, 41% higher mortality rate. So when they don't get breast cancer as often as white females. White females get diagnosed at a higher rate, but we die at a higher rate. So when we do get it, we tend to die at 41% higher mortality rate. So it's very important, since we don't know how to prevent it, we have to screen it and catch it early so that we can have the best possible chance of having a healthy life. You can get it treated. So if you can catch it when it's localized just in the breast and not spread to the lymph nodes or somewhere else, you have a very good chance of survival rate. The one thing is for breast cancer for black women, we tend to have a more aggressive type of breast cancer and an earlier onset. So in the 30s and 40s, we can get it compared to the average population. So I just want people to know that the women need to get screened annually, and if they feel a lump, they need to go in and get that taken care of.
So say, for instance, you have a mastectomy, either is it a unilateral or then a bilateral?
Unilateral, bilateral. Mm-hmm.
So the reconstruction, does that put you at risk again?
No, if you get a mastectomy on one side, and they take away all the breast tissue, and you're left with just the muscle mass on the chest wall. Mm-hmm. Then they'll reconstruct that, and they put saline things. So they'll put the saline implant underneath your skin and in front of the muscle. So you have less chance of having breast cancer on that right side or one side where the mastectomy was, but you're at risk for having breast cancer on the other side because you have breast tissue.
And so some people who come from a history of breast cancer, they just before it even starts, they get both breasts removed and then have it reconstructed.
Yeah, that was what Angelina Jolie did. Because her mother died from breast cancer, she went ahead and tested genetically and found that she had BRCA1, BRCA2 mutation. So she was at much higher risk, especially with a family member and the genetic mutation. She went ahead and prophylactically, prevention, had both a bilateral mastectomy and then had reconstruction. So that without breast tissue there, you have a very low chance of having breast cancer.
Now, my question would be, is that covered in your normal health care coverage?
For the most part, it should be. Screening is, removal, reconstruction should be. And I think the prevention piece, like that case I just mentioned, probably is because of the higher rate of it. Why do you want to wait and get cancer and then be reactive? If you know you have a very strong family history and you yourself have a mutation, I think most of that is covered for the average health insurance.
Okay. Well, I think that we've asked a lot of questions that people have sent in. Let's go on to this month.
Okay. So this month, coming up in November, is Diabetes Awareness Month. Just want to let people know that it's a very common and prevalent condition, medical condition. A lot of people have diabetes. We do have type 1, which you tend to get in a younger age when the pancreas just stops working. It doesn't produce the insulin that's necessary. So you yourself are insulin dependent for the rest of your life. And you're constantly testing. So that's why they have those Dexcom and things like that you can attach the monitor onto the back of your arm, and you can see on your cell phone how your blood sugars are doing. That's a whole lot easier than sticking your finger 6 times a day. Mm-hmm. So we've come a long way in terms of managing type 1 diabetes. Type 2 tends to be more onset in adults, tends to be related to weight and the type of diets that we have. So, but we're finding now that when we're having larger kids, the kids are obese at 10 and 11, they're getting type 2 diabetes at a very early age, which means they're going to be at risk for the chronic conditions like heart disease and strokes and heart attacks related to diabetes because they've had sugar issues, diabetes issues for a while. So just know that there's type 1, type 2. There's ways to prevent getting type 2 by monitoring and managing our weight, watching what we eat, checking our sugar. So it's all about knowing your numbers. Mm-hmm. So if you go for your annual exam, you do need to make sure that you have your blood pressure checked, have your blood sugar checked, so an A1C, and then have cholesterol checked. Those things are important because together, if you have that I call the triad, which is horrible, if you have blood pressure, if you have a history of hypertension or having blood pressure problems, diabetes, and cholesterol, that's 3 strikes against you. I consider it not a matter of when you're going to have a stroke or a heart attack, not if, but when. Because all 3 of them put you at risk for heart disease. And when you have all 3, it's just, you have to manage all of them. Mm-hmm. Yeah. So I'm going to just run off a couple little things. Diabetes affects over 26 million people of all ages. Very serious medical condition, especially when it comes to our population, African American. It's like an epidemic in our community. And it's basically caused by the body's inability to break down the sugar and store it correctly into the cells. So what's happening is sugar is fuel. It's like you put gas in your gas tank. So it's fuel. We need it. But if we can't break it down and store it into the cells, into the closets, and then go into the closet and get it when we need it, and it's running around in our bloodstream, it is causing toxicity to all the organs. So everywhere that blood flows into your brain, into your heart, into your limbs, it affects it. And that's why diabetes is such a horrible disease, because if it's not well controlled, it can affect everything. You can go blind, you can have a stroke, you can have a heart attack, you can have peripheral artery disease, when you have that, you can have amputations. So if you have diabetes that's out of control for a long period of time and it damages things, you can go blind. Mm-hmm. You can have kidney failure. Okay, if you go to any dialysis unit, you're going to see it's black and brown people in there, mostly. Wow. I hardly see a white person in there because we have the disease. Hispanics, African Americans, we have the disease, and sometimes we don't take good care of it, so it knocks out our kidneys, and then we're on dialysis waiting for a kidney transplant, and we tend not to want to be an organ donor. So, when we die, when we have an accident or something, we don't have on our driver's license that we're an organ donor. Mm-hmm. So then we just bury 2 good kidneys, right? So, we are asking our family members to make sure that, if they need a kidney, you're asking our family members to test and see if they're eligible. But keep in mind that you might want to consider being an organ donor, because if you unfortunately get into an accident or something, you have healthy organs that could help save a life. And so that's important. That's just a plug, because personally, a personal history of my 12-year-old niece who got hit by a car and killed, we made sure we donated all her healthy organs instead of burying them. And you can still harvest them and have an open casket.
Yeah. And, I think one of the things about it is, from a spiritual standpoint, a biblical standpoint, we feel like we want to take it all with us, but the bottom line is that we can continue to give by being an organ donor.
Yeah. I mean, when we die, our soul goes to heaven. Yeah. Our body's there. We should be able to still provide some health to some people, that give them a second chance. So keep that in mind. But yeah, it knocks out the kidneys. It's actually one of the major causes of heart disease and stroke. So that's why diabetes is so important to keep that under control. And it is preventable, but it's also manageable. So if you happen to be diagnosed with it, you can manage it so you don't have all of these complications. Just live a healthy life, making sure you keep your sugars under control. So I'm going to go through a couple risk factors. So risk factors, family history. If you have a family history of it, you have an increased chance of getting it yourself. Mm-hmm. If you carry extra weight, that's going to put you at risk for it. Dietary choices. So if we make poor choices, then we're, at every function we have, we're eating all the sweets and things like that. Concentrated sweets are just not good. Our body will. Wait a minute.
You gotta say what's concentrated sweets.
Okay, I'm sorry. Sugar in any form, like cookies, cakes, ice cream, donuts. Mm-hmm. Those are concentrated sweet. You're gonna get sugar naturally out of things. Like fruit has fructose in it. That's natural sugar. Uh-huh. And it's okay as long as you don't have too much, right? So for a diabetic, we will recommend they only have 2 fruits a day. Because if you have a whole platter, then that's too much sugar that the body cannot break down and store.
Okay, so that means when she said 2 fruit, that don't mean a whole watermelon.
Yeah.
That means a slice of watermelon.
Yeah,
Okay.
and even watermelon. There's fruits that have better concentration of sugar for our diabetics. So like watermelon and grapes are high in sugar. You might find a better. We might recommend apples and oranges, or some kind of a cantaloupe. But watermelon and grapes are pretty high in sugar, so you want to limit the amount you take in on that
Now,
one.
what about plums?
That's probably going to be okay because they're small too,
Uh-huh.
so you can't have 4 of them. But yes, so those are fine. But just keep that in mind. It's natural sugar, but it's still, if you eat too much of it, is not good for the diabetic. And then the other thing is the other risk factor is a history of gestational diabetes, which means that if you had diabetes when you were pregnant, you run a higher risk of getting it after pregnancy and later on in life.
Wow. Okay.
Yeah, and then the symptoms, I want people to understand the symptoms because they might be walking around with symptoms and just think, it's okay, just poo-poo on it and don't pay attention. But keep in mind, if you're just for no reason having frequent urination, all of a sudden you're just going more often 10, 12 times a day and you don't know why, and you're not having burning, you don't have a UTI, or a urinary tract infection, it may be one of the signs of diabetes. Increased thirst. So now you're thirsty and hungry all the time. Those are 2 big indicators. Blurred vision for no reason. And that's the reason why sugar is running around, starting to cause problems with your vision. So blurred vision is another one. Just having weight loss for no reason. So yes, we want to lose weight, but if you're actively not trying, you're not out there exercising, and you haven't cut your calories down and taken out things that are high in calories out of your diet, but you're losing weight, that's another indicator. And then just feeling tired all the time for no reason. All of a sudden you're fine last month, but now nothing's changed. No, your schedule hasn't changed. You're still eating the same, and you're exercising, and you're getting the rest you need. But now you're just feeling tired all the time. That could be diabetes, along with things like for women, recurrent yeast infections that just won't go away. You have a yeast infection, we treat it. We have a yeast infection. That's another indicator of diabetes. So you need to, if you have those symptoms, 1, 2, 3, or more of them, please get checked. And then I already mentioned to you the complications of having, so when you have your blood sugars too high, it's for too long, it starts damaging all the blood vessels that goes to all of the nerves and all the other conditions. So these are the conditions. When I say stroke, we call it in medical terms a cerebral vascular event, a CVA. So a stroke, heart attack, coronary artery disease, because you've damaged those coronary arteries, the arteries in the heart. Kidney failure, dialysis, kidney transplant, those types of things, nephrology or nephritis, or neuropathy in terms of nerves, and nephropathy for kidneys. Okay, so these are the legal terms or the medical terms for it, but it's just all the different organs that are damaged. And then amputations, so peripheral vascular disease, arterial disease, and then blindness is retinopathy. Mm-hmm. So just think every major organ can be damaged from all the sugar that's leading to them.
So type 1 diabetes is a childhood, early on, incident-terrestrialized. Type 2 can be managed. So say, for instance, you get diagnosed with type 2 diabetes, and you want to get off the insulin, you want to get off of this. What should you do?
There's all kinds of things. So depending on if you're carrying extra weight, you got to get the weight down. If you are not making good choices in your diet, you have to make better choices. You have to go to probably more leaner proteins, less carbs, because they break down into a lot of sugar. Carbs meaning rice, white rice, bread, pastas, certain things like that. A sweet potato is better than a white potato. So you start making better choices, and then portion control. And then exercise, because you need to burn off calories, get the weight down. The first thing I would say is stay away from all sugar-sweetened beverages.
Okay.
All. Juices, sodas, all of that. Water, you can infuse your water with some fruit, mints, whatever, but sugar-sweetened beverages are no-no.
Well, what if they're 0 calories?
Yeah. But they're sweet, right? Something's in there.
Uh-huh.
It's an artificial sweetener.
Okay.
So stay away from all of that, because that's actually even worse.
You mean to tell me that Coke Zero is not good for you?
No.
Okay.
Absolutely not. The
So-
zero is not, the zero might be the calories or the extra sugar added, but there is a sweetener. There's like 20, 30 different types of sweeteners, that end up in OSC, fructose, dextrose, whatever, and then you have the saccharin. So there's sweeteners in it. If that thing is sweet, but it says no sugar, then you have to figure out what's in it. What artificial sweetener do they have in there? And that's, to me, more toxic than just having, your natural fruit. So stay away from anything, any beverage that's sweet. You need to go ahead. And you can have your tea or coffee with a teaspoon of honey or something like that. But I would not do the sugar-sweetened beverages or the high fructose corn syrup stuff.
Okay. And even if it's natural apple juice.
But think about how many apples has to be squished into that 4 ounces.
I know, but I got a juicer and I put one apple in, and that apple just went right in there.
So if you do one apple and you juice your own stuff, you juice that, or you put that in your blender with your green veggies, that's fine. Because that's one of your fruits for the day. But unfortunately, juices usually has a lot of fruit in it, and sometimes it's added sugar too. So you can have the natural sugar things, but I'd rather you have the fruit because it also has fiber with the skin and all the pulp and all those things. So I'd rather you have the orange than the orange juice.
Okay. So can we play Ask Dr. Afflalo about our day and our food?
Your who and who?
Our day and our food. The day and our
Sure.
food. So say, for instance, I'm trying to get out of, and I'm not diabetic or type 1 or type 2, but say, for instance, I want to change my eating habits. Starting off in the morning, can I have a cup of coffee with nothing in it, just black coffee?
Sure.
Now, what about if I go in there and have a bagel with no cream cheese, just maybe a little bit of light chef with a butter substitute, and a boiled egg, and let's say 1 piece of bacon.
Mm-hmm.
Good or bad? How would we change that to make it be better?
So the protein, the egg is fine. The bacon is, if you don't that's a diabetic thing, but if you have blood pressure, I'd stay away from all kinds of things that have salt in it. Okay. So then you're talking about your bacons, right? If it's 1 slice, we'll let you go with it. The bagel, if it's a half a slice, fine, but keep in mind that is a carb. So, but if you don't have that every day, if you have something else on other days, maybe, an omelet with mostly egg whites and fruit, you're good. That would be good. You don't need some other, you can have, I don't do a whole lot of starchy stuff, so I don't even know what to tell you to substitute with. But I would, if you do 1 slice of a bagel and you do that 3 times a week, then that's okay.
Okay. And so is there any other things that you would recommend for like a bread substitute instead of eating like the bagel or the toast? What would be something, because people say eat a rice cake, but isn't rice cake just as bad?
Yeah, I'm not even sure what's in a rice cake. I don't know if it's all rice. I would say, how they do home fries? I would do like maybe just not the white potato, but a sweet potato. That's a healthier choice. And just maybe have a half a potato, and if you want to chop it up and, stir fry it into some olive oil or something, or bake it and have it. That's a better option. I don't know. It's hard because I don't really go down that avenue. But I would try to have less processed, so the white stuff is bleached. If you can have if someone makes sourdough bread or something, there's some breads that are a little bit better than others, but it's pretty much all carbs, and I would just make it small portions.
Even if it was gluten free?
Gluten has nothing to do with.
Okay. But people are asking this question. Everybody's like on this gluten free thing. So does that have anything impact when you look at your diabetes?
Not necessarily. I think gluten-free is for people that are having digestive issues, and so their stomach might be an issue, and they try to remove the gluten from the diet to see if that'll help. But I would just say if you can stick with more protein and veggies and fruits and things like that, you might be better off. And on occasion, if you want to have, like I said, a half a slice of something, I would do that, or maybe a small whole wheat tortilla or something. Yeah.
Now, are corn tortillas better than flour tortillas?
I don't really know.
Okay.
I think flour is probably, number 1, they're bigger, but number 2, they are based on flour. So if need be, I guess corn might be better, but I don't really know enough about those two.
Okay. So if I'm going into, let's say, for instance, lunch, before we go to lunch, let's talk about healthy snacks as a diabetic. What would be a healthy snack that I can have that would, kind of still keep my blood sugar at a certain level?
You could do things like carrot sticks with a little peanut butter or an almond butter. You can do uh, sometimes you can do things like I'm trying to think of snacks. Um, like cottage cheese or yogurt with some fruit in it.
What about feta cheese?
I think mozzarella string
Okay.
cheese might be a little bit better.
Okay.
Yeah.
All right. Now this because I
And
know a lot of
a boiled egg with something in it might be good. Go ahead.
because I know a lot of people have they came up with this thing called Nutella.
Hmm.
Now, is Nutella healthy or not healthy?
Well, that's a nut spread, almost like a peanut butter, but I don't know what nut it is that they grind up. So, I mean, most of those are protein, and then they have those little sticks, I think, that
Yeah.
you stick in. But I would rather than the stick, because that's a carb, I would do celery or carrot sticks or something like that with your protein. Because what they're trying to do is do protein. So that's a veggie and a protein. That would be a good, well-balanced snack.
Okay.
Yeah.
So if I go into lunch and I go in and say, you know what, I'm gonna be healthy now. Let me tell you, I'm gonna get me protein. I'm gonna have a chicken breast grilled.
Mm-hmm.
I'm gonna do an arugula salad
Mm-hmm.
with a vinaigrette dressing with zero
Calories.
calories, and I'll do some type of maybe cheese. That's the well, no, I already have the protein.
Mm-hmm.
But if I have the chicken and the salad, that would be a good lunch.
Mm-hmm.
Okay.
With a nice big glass of water.
Glass of water. Okay.
Yeah.
How many glasses of water should we be drinking a day?
Probably 6 to 8.
6 to 8.
Yeah, about up to 64 ounces. Sometimes you can go up more depending on your activity level. 70, 80 ounces. But if you're actively exercising and burning calories and or sweating a lot, you want to put some of that back in along with sometimes some electrolytes just to make sure, because when you're sweating, you do sweat out your sodium and potassium and things like that. So yeah, that's a good diet.
How many fluid ounces did you say?
64 fluid ounces.
64 fluid ounces
Yeah, it's
should be
8
on
glasses.
average.
Yeah, 8
Okay.
glasses, 6 to 8 glasses of water on average. We are made up of water, 70% water. So you do want to rehydrate your body and all the organs.
And the reason why I asked that is because that would calculate into this 4 of these bottles.
Yes.
Wow. And see, a lot of times when you say the number is 68, people are like, wow, I got to drink a lot of water. But in reality, it's
This
just
is-
4 of these bottles.
Yeah, 4 to 16 ounce bottles.
Yes,
Yeah,
wow. Okay.
yeah. So it's a good thing.
So, as we're looking at diabetics and we're seeing the multiple things that follow, if you have diabetes, if it's unmanaged, and then you couple it with blood pressure, you couple it with high cholesterol, you're saying not when, but not if, but
if, but
when you'll have some type of heart problem.
Yes. So when bringing that up is helpful because I actually want to talk about how we can prevent the strokes and the heart attacks. And that is knowing your numbers. So you kind of highlighted on that, and I want to go through. Everyone should know their numbers. If I ask them, how does your blood pressure run? They should know that. They should say my blood pressure runs about 120 over 68 or something like that, or 134 over 90. The thing I hear more often is that, yeah, my blood pressure runs around 150 over 90. And I said, and you've gone to the doctor and said, yeah, and my doctor says it's good. I'm like, no, that's not good. Know that normal blood pressure is less than 120 over less than 80. So your systolic, your top number is less than 120. And the bottom number, the diastolic, when the heart's at rest, is less than 80. That's a normal blood pressure. Anything over that, when you start getting from 120 to 129, before you get to 130, that's slightly elevated. When you get to 80 to 89, that's elevated. You start getting to hypertension number one when you get to 130 over 90. And then when you get over 140 over 98, you're talking about hypertension 2. Then you get into a crisis. So walking around with a blood pressure 140 over 90, I don't care what your doctor says, that's elevated and it's not well controlled. They're not doing you any favors by not talking to you about lifestyle changes and adjusting your medication or putting you on a medication if you're not on one.
So what if you were at like 130 over 70, 75?
We'll let you slide with that and just watch it closely. Yes.
Okay. Because, I've seen that also, and also seen that the different times that you take your blood pressure, it can go up and down. I find that my blood pressure is higher on hot days versus when it's cold. and I would say, well, and they would say, oh, well, just relax for a minute, and then they'll come back and say, oh, okay, you're good, because they said, oh, you must have been hustling to get in here. I said, I sure was,
Yeah.
you know.
And the best thing to do is actually to rest when you get into a doctor's office, to rest. Don't let them, sometimes they just want to slap the blood pressure cuff on you while they're sticking the thing in your mouth for temperature or in your ear, and then they're talking to you. That when a normal blood pressure or a good blood pressure, when they're taking it, the room should be quiet. They should not be talking to you and asking you questions. You should not be talking to them. And your back should be supported. So you should be in a chair, not on the exam table when your back is up and your legs are hanging. So your feet should be flat on the floor, not ankles crossed, no knees crossed or ankles crossed. And your back is supported. That's a good position. And then your arm that they're testing should be in an L position, where the cuff is right next to your heart, or on the other arm too, whichever one you prefer. But that's a good position. So when they have you on the exam table with your legs dangling, that's not a good blood pressure reading. You need to say, I want to sit down on the chair and have it tested. And if you are rushing in, you can tell them, I want to just take a minute, ask me your other questions, and then check the blood pressure. If it is elevated, they should check it a second time.
Okay.
And for people that are over 70, if their blood pressure is elevated, they should check it standing up.
Oh, wow.
Yes.
Now, why standing up?
Because the blood pressure tends to, especially for seniors, tend to just drop. It doesn't get it. When you stand up, your blood is still down in your feet. And so we need to give them a minute for the blood pressure to get up to the brain and all that, the heart. So we tell our seniors to change positions slowly. So when they're laying down, they need to sit up on the side of the bed for a few minutes, and then stand up before they start walking. They just can't jump out of bed and go to the bathroom. They will fall and injure something, break a hip. So elderly people over 70 definitely should have their second blood pressure reading done. If it's high, because we will treat a high blood pressure, but if we don't check it when they're standing, we're gonna overtreat them. They'll be too low, and then we're gonna cause problems. And if their blood pressure is too low, we need to know that. If they stand up, it's even lower. We're gonna have to figure out how to either take them off medications or something. We have to make sure that we don't put them at risk for falls.
So let me ask you a question. So when you're saying when you're getting older and you wake up out of sleep and you got to go to the restroom, tell me how we're supposed to do it so that we won't fall over.
Yeah. Just know that your blood pressure takes a couple, like 30 seconds or more to shift. So when you just go from a lying to a sitting, so you're laying down, you need to sit on the side of the bed for, 30 seconds or so. Let the blood start circulating. And then stand up for a couple seconds and then start walking. So if you just roll out of bed and get to the bathroom halfway there, if you're a senior and you're already, somewhat lightheaded, you will plunk somewhere in the room or in the bathroom.
Okay.
So you have to be very careful. Just change his positions.
Well, Dr. Afflalo, you're starting to make me feel old because when I get up, I sit on the side of the bed for a minute before I get up, and I get up and I stand and I look around before I start moving. And so I guess at a certain age, you just going to have to do that. Things have shifted.
Yeah, just slow down. You don't need to rush, And then when you get that signal, don't ignore the signal. Get up and start that process, because if you get the signal to go to the bathroom and you hold it, now you got to get up and run so you make it to the bathroom. Don't do that. Mm-hmm. When your body says signal time to go, your bladder's getting stretched, and just get up and do the process. It's not long, but you just don't want to change 3 positions, laying, sitting, standing, very quickly, and then go to the bathroom. Okay. We've had too many injuries in that way. So I was going to say, knowing their numbers, these are the ones they need to know. I spoke to you about the blood pressure needs to be definitely staying. I told you 120 over 80, less than that is normal. But we don't want you much higher than 130 over 80, okay? And then total cholesterol should be less than 200. Anything over that is considered high. The bad cholesterol, which is the LDL, I call that the lousy one, the L, should be less than 100. Over that, you start clogging up your arteries and creating plaque in the arteries that can narrow the arteries and cause you to have stroke or heart attack. And then the good cholesterol, the healthy one, HDL, should be higher for men, higher than 40, and for women, higher than 50. And the way how you get that is there's no medicine to really make that go up. You need to be active. So get active, stay active, and that'll help your HDL to improve. And then the last 2 things is your A1C. So if you are a diabetic and your A1C is crucial, it should be checked at least every 3 months. That's when it kind of changes. It needs to be less than 7. So on the new flyer, it has, the Richter scale on how you read it. So anything less than 5.7 is considered normal. No evidence of diabetes. If you're when you do an A1C, if you're 5.7 to 6.4, you're considered pre-diabetic. And that's when we really need to focus on getting things under control before you become a diabetic. Once you hit 6.5, you are labeled a diabetic.
Okay.
Labeled. It's a lab test that tells you whether or not you're pre-diabetic, not diabetic, pre-diabetic, or diabetic. And then we have to kick into gear and start doing things to make sure you don't continue to get higher. If you've been a diabetic for a long time and your A1C was 12 and 10 and 9 is coming down, you're safer if you get below 7. And that's the goal as a diabetic. And then the last thing is to keep your BMI less than 25. So just working on getting the weight down, exercising, lowering the calorie intake, burning the calories off with more exercise, building some muscle, which will help you burn calories more even after you exercise. So a little bit of weight training. You don't have to buff yourself up, but a little bit of weight training will help to build muscle. That will help you continue to have your metabolism going while you're sleeping and resting and working, and that'll help you lose the weight. So those are the key numbers that you need to know. So you need to know your blood pressure, your diabetic status, if you are or not, and then you need to know your cholesterol numbers.
Now, let me ask you this question, because you talked about artery plaque buildup in the arteries. My question to you is, if we know that it's happening, can't we do like a little Roto-Rooter at something where they just go and this clean out all the plaque?
So think about it. If you do a Roto-Rooter and you're loosening up something, that's traveling somewhere, right?
Well, no, not if you have the Roto-Rooter that sucks it, and catches everything.
Well, you go ahead and create that and patent it.
Okay.
Yeah,
okay.
but in the meantime, what we're trying to do is stabilize. Because from birth, if you start giving your kids, fast food, drive-through stuff, it is clogging up their arteries. So they're going to have clogged arteries at a much earlier age. If you've been eating somewhat healthy over the years, you have a better chance of not having clogged arteries. But the goal is that if your cholesterol is high, we have to stabilize that. We don't want it getting higher, creating more plaque, but we want to stabilize the plaque that's in there, which means usually some kind of a medication will lower the cholesterol level, the LDL level, and stabilize the plaque. If a little piece of plaque breaks off, like the pipe, the plumbing, little piece of that rusty stuff, it's going to go downstream.
Yeah.
Downstream is, if it's in the carotid artery in your neck, it's going to go up to your brain, and you're going to have a stroke somewhere. If it's in your heart in one of those narrowed coronary arteries, your right main, your left main, your whatever, all the different arteries, if that little piece breaks off and travels, it's going to clog something up. So you're going to have a heart attack in that artery wherever it lands. That part is going to die. That part of the artery, where that artery, wherever it's going to the heart, that part of the heart is going to die. Let's hope it's a small artery. Because you can have a heart attack and survive, depending on which artery has the issue. And so you don't want to have plaque sitting in your arteries not stabilized. So we usually end up suggesting people getting on a statin if they can to stabilize the plaque that's already there and to prevent it from building up.
Now, what does a statin do? Does it like cement it in or what?
Not necessarily, and I don't I don't know if it cements it in, but it does stabilize the plaque so it doesn't break it off. But it also lowers the cholesterol so it doesn't keep building on top.
Okay.
Like plaque on your teeth. If you don't get the plaque on your teeth scraped off by the dentist, it continues to build up and you have more and more plaque. That's why you go in every few months, at least twice a year, if not 3 times a year, to get the plaque removed, because that also puts you at risk for all kinds of oral conditions, right? Gingivitis and periodontal disease. So plaque is not good no matter where it is, whether it's on your teeth or whether it's in your arteries. So the best thing to do is, if you know your cholesterol is our best way of knowing. Now, if you start having issues like chest discomfort and thing, we're going to do an angiogram to look at the arteries in your heart to see which ones are narrowed. And I have a very close friend that just plays tennis all the time, and was starting to have a little bit of some tiredness or a little shortness of breath warming up. So, took a break. And then next thing we know, we did an angiogram. We did a calcium score that was very, very high. I've never seen one that high, in the 3,000s. Less than 100s we can work with. And then going to do an angiogram where they actually do a dye and look at the arteries around your heart. 3 of them were clogged, 90%, 80 or 90%, having an open heart bypass. Didn't know that. Playing tennis all the time, eating properly. So you never know, but if you pay attention to the to the symptoms that you're having, chest pain, shortness of breath, fatigue, whatever, get it checked. But if you know your cholesterol, get that treated. And so it's important. We have too many people are losing strokes and heart attacks that can be prevented if we just know our numbers and do the right thing.
Okay. All right. So moving forward, in diabetes, how can people seek help? I know that you have your monthly, once a month, first Wednesday of the month health clinic. Can they start there?
Absolutely. So that monthly community health and resource fair that we have at the Jackie Robinson YMCA is the first Wednesday of every month, except in January because it's too close to New Year's. So February through December, come out. It's free to everyone. And you can get your basic numbers that I'm talking about. You can at least get your blood pressure checked and get your fasting blood sugar check. Not fasting, I'm sorry. Random blood sugar check. So even if you've eaten breakfast or not, we can check your sugar to see if it's high. So if that's high, we're going to do an A1C, that hemoglobin A1C, to see if you have diabetes. If you know you have diabetes, we can check an A1C there also and tell you if your diabetes is controlled. And the other thing is if you have high blood pressure or diabetes or heart disease, we also can do your cholesterol, your lipid panel. So we can tell you all the numbers that I just spoke about are all offered at the health fair, which means you can know your total cholesterol, your LDL, HDL, the good, the bad cholesterol. Definitely can know your A1C. If you're a diabetic, we need to check it. We're not going to check every person on the street, but if you have a random sugar that's elevated, then we're going to check you for diabetes. But if you have a random sugar that's 80, there's no reason to check it, right? But anything elevated on that first screening is going to go straight to get a hemoglobin A1C. So the screening is important. I say come on down. At least get your screenings done. It's free of charge. And then if you find something that's elevated, we have providers there. We have medical providers there that can discuss those results and tell you what you need to do in terms of dietary changes. If you have some of those medical conditions, blood pressure, diabetes, cholesterol, they can find out what medicines you're on and make recommendations and tell them to follow back up with their doctor. But you may need to increase your cholesterol medicine because this number is still high, or your A1C is now 10 and you're going to need to increase your medication. Or newly diagnosed diabetics we've found with A1Cs of 12 and didn't know they had it. So we're diagnosing people there, not just treating, but screening. But we found some people that have hypertension that didn't know they had it. And we're not going to label you hypertensive with one abnormal reading, but that means you have to go and be seen to get 2 or 3 readings. If you've had 3 readings that are all elevated, we need to do something about it. So yes, come on out to the health fair. The next one's on November 5th. Not only do we have screenings, but we have all kinds of other things. We have our Many Shades of Pink that is doing, we always have breast exams every month. And then we have the mammogram van there from UCSD to provide mammograms if a lady needs one. We have the Shiley Eye Clinic that does free eye exams and glasses, vaccinations. And then you go down on the field and there's all kinds of vendors, about 45 vendors down there providing all kinds of other services. I think we're adding 2 new ones where they can now check blood for colon cancer. So we're offering that. And then there's going to be one coming. So we're always trying to add new resources and screening to make sure we can tell you what you have so you can go and seek help and try to treat it early.
And what about the food pantry?
Food distribution. So we do have food distribution, and it's a reward. So we are not labeled a food pantry. So you can go to churches and all kinds of places, food pantry, but we seek out to get food there so that once our providers go to the health fair and get their screening done, then we reward them with coming over there afterwards. They get a ticket and they get all the produce and dry goods that they need. So everyone is entitled to get that. We have to pay for some of that. So we're not there to just have people walk in and get food. We want them to participate and get their health addressed. So get your health screening done, and then you can get your food. So we have produce, fresh produce, both from Feeding San Diego and San Diego Food Bank.
Wonderful, wonderful. So Dr. Afflalo, with all the different things that you're giving, what are you seeing most when you're at your health fair? What are some of the biggest things that you are discovering that's impacting the communities that we're serving?
I think mostly the community there, it's really just making sure that they know what medical conditions they have or that the medical conditions that they have are being well controlled. So I think they really like coming to get the screening and speaking to the providers. And then we have health education too. That's very popular. and then they get all the resources down there. They are, they used to come and do the pet services, but I think the most important thing, and I think what's going to grow now, is a food pantry because of all the things that are being shut down and all of the, people being furloughed and losing their jobs, that they're really seeking and possibly losing their health insurance. So they need to come out and at least get screened so that we can know what's going on, and then we'll provide food for them. So I think just the health piece, the insurance piece, and the food distribution are probably our key drivers that keeps that going.
Now, what about mental health when people are coming? How are we serving? Because there's a lot of stressors that are taking place.
Yeah, there are mental health providers out there, and so there are organizations that provide services. Some of them provide free, some at low cost, some connected will charge their insurance, but they will see them, and some are culturally sensitive. So we have African American providers out there. So yes, there's within the vendors, there's all kinds of different resources, including mental health and all the other things.
Yes. And so diabetes, just going back to that, it seems like it's affecting more the African American and Latino population. Are we the highest with the numbers with diabetes, or is it more than just us in that sense?
No.
Chronic.
Right. I would say we have African Americans and Latinos, especially African Americans, highest rate of diabetes, and therefore a higher risk of all the complications of it. So yes, we are, when you start talking about all of the bad things, all of the chronic medical conditions, we are on the high list of hypertension, diabetes, cholesterol, heart disease, strokes. We are on the top of the list. You start looking at graphs that they sent out with the county, and you'll see our graph is the highest. So it's unfortunate because some of that can be prevented, but it can definitely be controlled. We just have to make up our mind to do the right thing. And when we have these gatherings, offer healthy choices so that we don't have to eat the fried chicken. Offer a baked chicken, offer something else. We just need to do better. And instead of having all these sodas, how about just having the bottled waters or something? They'll drink it.
Well, let me ask you a question because, when I began to try to say, well, let's eat more healthier. So I said, well, let's do more grilled food. But then they came back and said that the coal was causing cancer. That had carcinogenics. So tell us about that. Grilled with no coal, this propane. What can help us so that we can, still have flavor, but then not, put ourselves at more risk of doing something else different.
Yeah, I wouldn't grill that often. I mean, on special occasions, your 4th of July and your whatever, we should be just grilling it in the oven. Okay. You don't have to be that fancy, but I know people like to grill. They use propane a lot. I'm sure all of those things have some carcinogens. So if you're doing it often, there's risk for it. Mm-hmm. I don't know all the statistics and details in it, but I just know that if we try to do things as simple as possible, in your oven, if you can grill it in there or bake it, and or what's the other one? I forget. Broil it, yes. Mm-hmm. Anything like that. The air fryer, where you use minimal amount of oil. If you even want to pan sear it, minimal amount of a healthier oil. Those things I think are good. So as close to less processed and less, extra stuff will help you. So, and take the skin off your chicken because that's a whole bunch of fat. Just go to the lean protein somewhere.
So let me ask you this question. I have been doing some lifestyle changes and things of that nature. And what are your thoughts on beans?
Beans are healthy. Okay. Beans are healthy. Beans, legumes, things like that. That's a protein source also. Okay. Some people can't handle them because they're gas producing. Uh-huh. But beans are healthy.
Yeah.
Yeah.
And what I found out is that you can do beans and make them very tasty without using any type of protein in it.
Yeah. You don't have to put that turkey neck or smoked turkey thing or whatever. You can season it with onions and bell peppers and some pepper and things like that. The seasoning is what's important. So sometimes you say you want to grill it, but you can also put that seasoning, blackened seasoning on your chicken and grill it in the oven. So yes, beans are good, lentils are good, anything like all the legumes are healthy for you.
Okay. And then last but not least, the Instant Pot. I heard that the Instant Pot now is the way to go when you're trying to get something quicker. Beans, you slow cook those. But now the Instant Pot, you can actually do a whole thing of beans in an hour versus, the old-fashioned way.
Yeah, they've come up with all kinds of interesting things. So the Instapot, the ones whatever, it's almost like a pressure cooker, but on a faster scale. So we would soak the beans overnight and then cook them, and that
So
sort
we
of
had to
thing
get
forever.
the gas off of them.
Yeah, all of that.
Yeah.
So, but now they have all of these, and then we had a slow cooker that you put some in and you turn it on low and you go to work and come back and it's cooked, and then the pressure cooker that would make things very quickly. They just keep finding more convenient gadgets to cook your food faster because we're on the go, and that at least will prevent you from going through some drive-through. So if you have that, you can still have your meals in a timely fashion. So there are things. I have one. I haven't used it yet, but yes, the air fryer seems to be a big thing that caught on for a lot of people. You can put your stuff in there and have your crispy whatever it is that you want.
And I think that's the key thing is that it's a good place to reheat so that you get the crispiness, or you could go there and I actually did fries in an air fryer, and it actually turned out very, very good. So basically, to help with diabetes, especially type 2 diabetes, is really changing our eating habits. And should we be able to see based on what we eat, if we took our blood sugar, it should show what we're eating?
It will show you whether or not you're able to process it. So I usually recommend people check their sugars in the morning and then 2 hours after meal. If you check it 1 hour, your digestive system hasn't had time to break it down and store it into the closet. So don't test it. Test it about 2 hours later when it's had a chance to do things. That'll give you a good idea as to whether or not your body's functioning and handling the sugar properly.
Now, say for instance you don't have diabetes, but you want to monitor yourself. Is that a good idea to get one of those things and monitor yourself?
Well, the Dexicon or the other attachment ones on your thing, that's not even approved unless you're going to pay for it out of pocket. I wouldn't do all that because your sugars are going to go up and down all day long. You'll drive yourself crazy and be neurotic about, oh my God, my sugar's 300, but you just ate a full meal. So I would just say I wouldn't do that. I would just check on occasion a random sugar or an A1C annually, hemoglobin A1C annually, and make sure you're not creeping into the pre-diabetes or diabetes. And then, of course, if you are up there, then it can be checked more often. So I wouldn't go into finger sticking and stuff unless you're labeled diabetic and or we need to monitor your sugars a little more closely. That's too much work.
Well, with that being said, I think that we have exhausted some of the information for today on diabetes as well as on getting your mammograms and checking so that you will not get breast cancer or be able to discover it early. As well as we know that we, again, this first Wednesday, November 5th, there will be the Community Health and Resource Fair at the Jackie Robinson YMCA, and it starts at 10 a.m.
Yeah.
And goes all the way to 3 p.m.
Yes.
Well, any final words, Dr.?
No, just I want people to stay healthy or get healthy and live a long and prosperous life.
Well, there you have it. Ask Dr. Afflalo right here on GODRadio1.com. Have a good evening.